Good morning. So today we will start with plastic surgery. So let me introduce myself. My name is Pranshu Agrawal and I am MD third year student. We will start with some basic definitions. Autograft. Autograft is a graft which is taken from the same person. For example, skin graft. Isograft. Isograft, as the name suggests, it is taken from identical twin. Allograft. Allograft is a graft which is taken from the same species, for example, in renal transplant. Xenograft. Xenograft. Graft taken from different species, for example, in the porcine heart valves. Graft. A graft is a piece of tissue that does not have its own blood supply. Yes, please note that graft does not have its own blood supply. But, in contrast, a flap has its own blood supply. A flap has its own blood supply. Now we will move on to a major topic known as skin grafts. There can be two types of skin grafts. First, split thickness skin graft, which is also known as Thier's graft, and the second one is full thickness skin graft, which is also known as Wolf's graft. Now we'll move on to differences between these two. Now we will move on to the differences between the split thickness and the full thickness skin graft. So, starting on with split thickness. It covers epidermis and the part of dermis. The thickness ranges from 0.006 to 0.24 inches. The instrument used here is called the Humbee's knife. This is a very important MCQ question. The most common donor site is the thigh and the buttocks region. The donor area is larger here. The optimum thickness is harvested if we visualize the punctate bleeding points. The dressing of the donor is done and can be removed after 20 to 21 days. The site can also be reused in the split thickness skin grafts. Now coming on to full thickness skin grafts. Unlike split thickness, which covers only epidermis and part of dermis, and full thickness, it covers epidermis and the whole dermis. The instrument here is the knife. The most common donor sites are supraclavicular fossa, infraclavicular fossa, hairless groin, and the post-auricular region. The donor area is smaller here. The donor area is sutured in the full thickness skin grafts. In full thickness skin grafts, the site cannot be reused. Now we'll move on to the two types of contracture. The primary contracture. Primary contracture is at the time of the harvest of graft. It is directly proportional to the amount of dermis. Primary contracture is directly proportional to the amount of dermis. Full thickness skin grafts have higher primary contracture. Full thickness have higher primary contracture. Secondary contracture. This occurs after it is placed on the recipient side and it is indirectly proportional to the amount of dermis. So, as we see, primary contracture is directly proportional to the amount of dermis and secondary contracture is indirectly proportional to the amount of dermis. Split thickness skin grafts have higher secondary contracture. Just like full thickness have higher primary contracture, the split thickness have higher secondary contracture. So, as I told you, split thickness skin grafts have higher secondary contracture rates. So, the meshing of the split thickness skin graft is done due to higher rate of secondary contracture, as it increases the surface area by 5 times. But ideally, it is 1.5 times. This makes sure that even after contracture, there will be enough skin present. It also helps to prevent seroma formation. It takes around 10 to 14 days for the graft to become adherent to the recipient site. Hence, the patient are advised to avoid any vigorous activities or movement. Therefore, in the first 4 to 5 days, we do a tie-over blister dressing to avoid movement and assure the graft is adherent to the recipient site. There are three methods by which the split skin graft survives. First, imbibition or the plasmatic circulation. In this, it absorbs fluid and nutrients from the recipient bed that occurs between first 24 to 48 hours. In osculation, the small buds will start coming from the donor side into the recipient side and they will draw nutrition for the graft. This stage occurs between first 2 to 4 days. Neovascularization, anastomosis between the donor and the recipient vessel and it starts after the 4 days. So, the survival method of the split skin graft. The first method, which occurs earliest, is the imbibition or the plasmatic circulation between first 24 to 48 hours. The second is anosculation, which occurs between first 2 to 4 days, and third is neovascularization, in which anastomosis between donor and the recipient vessel is done and it starts after the first 4 days. We have to learn these steps by the nature of their occurring and by the duration of their occurring. Thank you. In the next module, we will learn about flaps.